My name is Dr. Catherine Takem. When we hear the term human trafficking, we tend to think of sex and crime and nothing else. That's a very big mistake, because when we do that, we develop a tunnel vision, focusing only on the legal aspect, and we miss the opportunity to help save lives. As a healthcare provider, I can attest to the fact that the healthcare system can do more than just to save our girls and women who have been victimized on the streets. I just recently found out that in Broward County, Pembroke Pines is the hub of the human trafficking. And every time I drive through Pines Boulevard, I look to my right, to my left to see if there are young women and young girls on the street being trafficked. But they are very difficult to find, so you'll have to be vigilant. I want to say that these people who have been victimized by traffickers have the right to be screened and identified in the urgent care and emergency rooms everywhere in Florida. Since there are no designated sets of characteristics for the providers to identify and treat appropriately, approximately 18,000 people are trafficked in the United States every year and are forced into commercial sex work. A huge percentage of these victims are seen by the healthcare professionals in the urgent care and emergency rooms, but they are not recognized. Some of the perpetrators are our friends, relatives, gang members, smugglers, pimps and madams, massage parlor owners, and labor subcontractors. The U.S. Department of Health and Services initiated the Rescue and Restore Victim Human Trafficking campaign. They also developed educational toolkits to help service providers identify the victims. Trafficking and awareness training was also instituted by the Healthcare Act, and it was passed by the federal government. However, lack of investigational and ineffective law implementation has made the law very inactive. Some hospitals, though, have developed their own protocols for the service providers to follow, but it's not consistent. Therefore, the Health Task Force for District 38 found the need to unify these problems. For these and many other reasons, the Senate District 38 Health Task Force, under the leadership of Senator Daphne Campbell, have filed a bill, SB 1784, that proposes a standard model assessment of human trafficking at all Florida healthcare settings. This will be evidence-based identification, treatment, and referral protocols for all emergency rooms and urgent care facilities. We look forward to you and your support of this bill, 1784. Thank you for giving us, this panel, the opportunity to explain to you what we, the Health Task Force, is doing on behalf of our constituents.